Hello and welcome to another live broadcast with MedStar Health. My name is Karen Zengel and I'm joined today by Dr. Walter Hembree, foot and ankle surgeon at MedStar Orthopedic Institute. Today we're going to discuss foot and ankle conditions. If you have any questions during the broadcast, please ask them in the questions below. Dr. Hembree, thank you so much for joining us today.
No problem at all.
Before we get started with some questions, could you tell our audience a little bit about yourself?
Of course. My name's Dr. Walter Hembree. I am a foot and ankle specialist at MedStar Health Orthopedic Institute. That means I've completed both an orthopedic surgical residency and a fellowship training in foot and ankle surgery. And so the bulk of what I see in my office are foot and ankle problems.
Thank you. All right, well, let's get started with some questions for you. So you specialize in foot and ankle orthopedic care. How does that differ from podiatry?
So I think one thing that we as orthopedists bring to the table is our background in medical sciences. And so whereas podiatrists focus their training and education specifically on the foot, we have a breadth of knowledge on the whole body as medical doctors, and sometimes that helps us in terms of our ability to diagnose and potentially treat problems in the patient. And there are, some very good podiatrists out there as well, and so there is some cross-pollination, if you will, between the two specialties, and we often work hand in hand many times to treat patients in combination for a variety of problems.
Okay, thank you. So what kind of conditions do you treat?
I treat anything that's foot and ankle related, foot arthritis, foot trauma, fractures, tendon ruptures, deformities in the forefoot like bunion, hammer toe deformities, just general aches and pains in the foot, ankle arthritis. I do ankle replacements, ankle fusions on occasion, just about anything that a patient might show up and complain about relating to the foot and ankle would be on my radar in terms of what I treat.
Okay, thank you. So let's talk a little bit more about each of those conditions and how they are treated. So let's first talk about ankle arthritis. When does a patient know when it's time to seek your help?
So ankle arthritis, really any arthritis, but ankle arthritis in particular has kind of come to the forefront in our field over the last 15 to 20 years in terms of ankle replacements. And so the types of ankle replacements that are available to us today are much better than they were even 20 years ago. And so that's become a much better treatment option for ankle arthritis for select patients that want to maintain motion at the joint and also eradicate the pain from the arthritis.
Okay, thank you. What about Achilles tendon? Isn't that usually a sports injury?
Yeah, so it is a sport-related injury. When you say Achilles tendon, that can mean a variety of things. Tendonitis can mean tendinosis. It can mean tendon rupture. Typically, when I get involved is when someone develops a tendonitis that isn't getting better with conservative treatment. So most often patients will first see their family doctor, who will prescribe some physical therapy, anti-inflammatories, maybe some bracing. Things are improving, and so they're referred to a surgeon to determine if they might be a candidate for some type of surgical intervention to alleviate their pain. And then Achilles tendon ruptures, we see a lot of Achilles tendon ruptures, and that's another type of injury that is changing in terms of how we treat it over the past 5 to 10 years. There's a growing body of literature to suggest that some patients might do just as well without surgery as with. And it is obviously patient dependent, depends on activity level, athletic aspirations. I still fix a lot of Achilles tendon ruptures, but some patients elect for non-op treatment as well with almost equivalent outcomes depending on what study you want to look at and believe in the literature.
Okay, thank you. So let's talk more about bunions. They're pretty common, aren't they?
Very common. I see a lot of bunions. In fact, I just saw 3 patients with bunions in my office this morning.
Wow.
And very common complaint. And bunions are another thing that, it's all patient dependent in terms of when you want to pull the trigger and have something done about it. It's all about symptoms. And so when those symptoms aren't responding to conservative measures like shoe wear adjustments, padding, oral anti-inflammatories, and the pain's beginning to limit things you want to do in your day-to-day life, then it might be reasonable to consider having the bunion realigned. There are different types of bunion surgeries out there. There's probably over 50 different types of bunion surgeries described in the literature, and It all depends on the type of the deformity, the severity of the deformity, the patient, their medical background in terms of what procedure is best for each individual patient. But I think some of the newer techniques we're using nowadays for bunion, be it the percutaneous or the open techniques with more robust fixation that are allowing earlier return to activity and weight bearing, have really changed the landscape in terms of how we're treating bunion surgery.
Okay, thank you. So we got a few questions from Facebook, so we can go ahead and get into those now.
Sure.
So the first question is from Harriet. She said, I have pain in my Achilles tendon. So we talked a little bit about that earlier. After sitting for a while, once I get up and get moving, it goes away. Is this something that needs to be addressed? I had heel spurs many years ago. Is this related?
Well, in terms of the heel spur, that's kind of a generic term. And let me first say, all these answers are just related to these Facebook questions. Obviously, it's important to seek out, official medical advice regarding treatment of any of these types of complaints or injuries. But in terms of heel spurs, that can relate to a spur where your Achilles tendon connects to the bone. It can relate to a spur that's more plantar on the bottom of your foot. And so that can have, implications in terms of what might be causing the pain or how it would be treated. So that's a little difficult to assess without seeing an x-ray and or examining the foot. But in terms of the Achilles specifically, yes, spurring can sometimes be seen on x-ray and clinically in conjunction with pain at the point where the tendon attaches to the bone. And in those types of situations, general rule of thumb is to start conservative and work up towards surgery. So things like physical therapy, bracing can sometimes be helpful. Oral or topical anti-inflammatories can sometimes be helpful. If those types of interventions don't work, then surgery is sometimes considered. And so for the variety of Achilles tendon pain that's called insertional tendonitis, meaning there's a spur right where the tendon hooks onto the bone, we can do surgeries where we go in and remove the spur, reattach the tendon, and alleviate that pain. And in general, that works very well. Obviously, there's always outliers, but it's a good operation. The recovery can be a little bit of a bear for patients at times just because there is some weight-bearing restriction for 4 to 6 weeks afterwards and then progressive weight in a boot. But it is a commonly done procedure and can be effective alleviating that Achilles tendon pain.
Thank you. And thank you, Harriet, for that question. The next one is from Diana. I'm 61 and have very flimsy ankles. I broke my left one along with my ligaments 3 months ago. Still not better, and last Saturday I fell down and sprained my right ankle. Any suggestions for Diana?
Again, without having the opportunity to examine her ankles or see x-rays, what she's describing sounds a lot like functional ankle instability. And so sometimes when we sprain our ankles, the ligaments don't heal up quite right, and the ankle can become loose, and the ankle can become quote unquote floppy or flimsy, I think as she described it. And so that leads to ankle instability. Patients will commonly complain of falling, continually twisting the ankle, it feeling loose, giving way. That type of thing can be treated with bracing. Sometimes therapy is helpful. Sometimes patients need an operation to tighten the ankle ligaments and stabilize the ankle. Again, that would be something that would have to be addressed specifically, with a medical professional in terms of what might be the best avenue, but there are treatments available to help with that type of thing.
Okay, thank you. And thank you, Diana. This next one is from Anita. I broke my right ankle a couple times. First when I was 14 from a growth plate injury, and now that I'm in my 50s, I have back and hip problems. Could it be leg discrepancy causing my back and hip problems? How do I get tested for that?
That's a reasonable possibility that there could be some discrepancy in leg length contributing to back and hip problems. Just a basic clinical exam can sometimes help identify leg length discrepancy. A specialized type of x-ray of the entire length of the leg from the waist down is often utilized to really pinpoint the exact discrepancy and where it might be located in the leg. And if it's severe, then there are specialized procedures that can be done on occasion to lengthen the leg. If it's a minimal discrepancy, patients will sometimes benefit from something as simple as a shoe lift or a custom piece built on the bottom of their shoe to kind of balance out the discrepancy and make it more equal on one side to the other.
Okay, thank you. And thank you, Anita. So we got a question from Instagram. Is surgery ever an option for plantar fasciitis?
Yeah, so plantar fasciitis, I mean, that is an extremely common condition.
Mm-hmm.
I see a lot of patients with plantar fasciitis, and it's very debilitating, it's very painful. The good news is that most of the time, 9 out of 10 cases will eventually burn themselves out on their own and go away. There are some things we can do to kind of help it along the way, things like stretching, formal physical therapy, boot or casting, night splinting. There are some types of injections that can be done, injection therapy, shockwave therapy. Generally speaking, most surgeons like to wait at least 6 to 12 months before considering an operation for plantar fasciitis, because most of the time it'll eventually go away on its own, but also because sometimes surgery is not always successful for plantar fasciitis,
Mm-hmm.
and the data is a little mixed in terms of the outcomes with surgery for plantar fasciitis, and so it's kind of a last resort option in my practice. But yes, surgery is an option if you've done all those other things. You've had the symptoms for 6 or 12 months or more, and it's just debilitating. You can consider an operation to go in and do what's called a partial plantar fascia release. There's different ways to do that. It can be done through a scope, what's called endoscopic plantar fascia release. It can be done open through a slightly larger incision, and it just depends on the specific patient and what the indications might be in terms, and surgeon experience in terms
Mm-hmm.
of how it's approached.
Okay, thank you. So thank you for talking about the conditions and the treatment options and for answering our online questions. Let's talk more about MedStar Orthopedic Institute. So why should patients choose MedStar Orthopedic Institute for their foot and ankle care?
Well, gosh, a variety of reasons. We have 4 fellowship-trained specialists here in foot and ankle surgery. We are a nationally renowned institution for research in orthopedics and specifically in foot and ankle. And so we are constantly striving to improve ourselves clinically by doing our basic science and clinical and biomechanical research in our lab here. We have great new facilities. We've recently updated our facility here at Union Memorial Hospital.
Looks great.
Recently acquired a new weight-bearing CT scanner. That's a new technology that's coming to the forefront over the past 5 years, and we now have one here at our institution, which will help us make gains in terms of diagnosing and treating deformities around the foot and ankle.
Wonderful. Thank you. Is there anything else you'd like to add for our viewers that they should understand about foot and ankle conditions before we wrap up?
I would just say that, don't let your foot and ankle keep you down. If your pain is limiting things you want to do in life, limiting athletic pursuits, it may be time to seek out a specialist to keep you moving and keep you active, because that's important. Got to keep living.
Yeah,
So.
Great tips. Thank you so much.
No problem at all.
So that's all the questions we have for today. If you do have any other questions for Dr. Hembree, please ask them in the comments and we'll be sure to answer them. If you would like any more information about MedStar Orthopedic Institute or would like to schedule an appointment with Dr. Hembree, visit medstarortho.org/Hembree, and that's spelled Hembree. Thank you very much for joining us today, and thank you.
No problem. Thank you.